If you woke up strapped to a table in the 1300s, you literally could not tell if you were being executed or cured. These horrifying metal devices were completely legal, and the so-called surgeons using them had zero medical training. They learned by watching, they learned by doing. And their patients. When a sick person entered a medieval hospital, their property was disposed of, and in some regions, a requiem mass was held for them, as if they had already died. This is the story of how medieval surgery became indistinguishable from medieval torture, how the church banned it, and how the line between healing and punishment grew so thin that the same instrument served both purposes. Start with what these people actually believed. In the Middle Ages, medicine was still rooted in an ancient Greek framework. The body, they thought, was governed by four humors: yellow bile, phlegm, black bile, and blood. These corresponded to the four elements: fire, water, earth, and air. Disease wasn't caused by germs, and it wasn't caused by viruses. It was caused by imbalance. Too much blood, you were sick. Too much black bile, you were melancholic. And the cure was brutally simple: purge the excess, bleed the patient, cup them, leech them, drain the sickness out. This framework didn't emerge in isolation. The Persian physician Avicenna, known in the Arab world as Ibn Sina, synthesized and extended Greek humoral theory in his encyclopedic canon of medicine, completed around 1025. That single text became the dominant medical authority in both the Islamic world and medieval Europe for over 5 centuries, and it carried humoral doctrine deep into every physician's training. When European doctors bled their patients, they were, in a very real sense, following Avicenna's instructions. That's where bloodletting enters the picture, and it dominated medieval medicine for centuries. The practice began over 3,000 years ago with the ancient Egyptians, passed through the Greeks and Romans, spread across the Arab world and Asia, and then saturated Europe during the Middle Ages. Practitioners would nick veins or arteries in the forearm or neck using specialized tools, lancets, and fleams that folded out like crude Swiss army knives, each blade designed for a different vein. And it wasn't just lancets. Hirudo medicinalis, the medicinal leech, was prescribed by Galen and remained a standard clinical tool well into the 19th century, deployed whenever a physician wanted more precise, localized bleeding. Bloodletting was so normalized that monasteries across medieval England maintained dedicated bleeding houses called phlebota Maria. Members of the Order of St. Victor were bled 5 times a year on a fixed schedule: before Advent, before Lent, after Easter, on May Day, and at Pentecost. This wasn't emergency medicine. This was routine maintenance, and the practice didn't die with the Middle Ages. On December 14, 1799, George Washington fell ill with a severe throat infection. His physicians responded the only way they knew how, following a tradition championed by the influential American physician Dr. Benjamin Rush, who advocated aggressive bloodletting as a near-universal cure. Over approximately 9 to 10 hours, they drained somewhere between 124 and 126 ounces of blood from his body. That's nearly 3 3/4 liters, roughly 40% of his total blood volume, gone. Washington died that same day. Bloodletting was only formally discredited in the late 19th century and was still being recommended in medical textbooks as late as 1942. And if stories like this are your kind of thing, the darkest, strangest corners of medieval history, subscribe, because it gets much worse from here, because bloodletting was just the beginning. But bloodletting was just the beginning. The surgical tools used during this era were staggering in their variety and their capacity for suffering. Cauterization, pressing red-hot irons against flesh, was used to stop bleeding, yes, but also to treat tooth extractions and even mental illness. The wounds it left behind were severe burns that resisted healing. Amputations were performed with saws and knives that, if dull, would lengthen the agony and splinter bone. Speculums were hand-cranked open without any understanding of what the physician was even looking for, causing tearing, bruising, and infection in an era where sterilization simply did not exist. Then there was trepanation, drilling a hole directly into a living person's skull. prescribed for everything from migraines to seizures to what was believed to be demonic possession. Special hand-crank drills or sharp chisels bored into the cranium, often with the patient fully conscious and physically restrained. The remarkable thing, some people survived. Skulls from the period show clear evidence of bone regrowth. Out of 8 trepanned skulls found in southwestern Germany dating from the 6th to 8th centuries, 7 showed signs of healing. Survival rates varied wildly, around 40% in the earliest periods, climbing as high as 91% in certain medieval Peruvian samples. Compare that to the American Civil War, where cranial surgery mortality ran between 46 and 56%, with metal instruments and formal medical training. The one MRSA available was the soporific sponge, medieval Europe's attempt at anesthesia. Developed by the Salerno School of Medicine, the Scola Medica Salernitana, which stands as the first organized medical school in medieval Europe, it emerged in southern Italy and became the intellectual engine of early European medicine. Scholars like Constantine the African translated Arabic and Greek medical texts there, creating a bridge between Islamic Golden Age knowledge and European practice. The soporific sponge itself was refined in the late 12th century, particularly by the Italian surgeon Ugo Borgognoni, building on the earlier antiseptic work of his father, Theodoric Borgognoni, who controversially championed wine-based wound cleaning and openly rejected the prevailing Galenic doctrine of laudable pus, the bizarre belief that a wound producing thick yellow discharge was actually healing correctly. The sponge involved soaking it in a dissolved solution of opium, hemlock, henbane, and mandrake, letting it dry in the sun, then rehydrating it with hot water before pressing it under the patient's nose. It worked, sometimes. The problem was terrifyingly simple. The dosage required to knock someone unconscious was nearly identical to the dosage required to kill them. So who was actually performing all of this? Here's where it gets stranger. In 1163, the Council of Tours issued a decree: no clergyman or monk should undertake any bloody operation. The principle was captured in the Latin phrase Ecclesia abhorret a sanguine, the Church abhors blood. This was reinforced at the Council of 1179 and again at the Fourth Lateran Council in 1215, which banned all priests, deacons, and subdeacons from practicing surgery under penalty of excommunication. For centuries, monks and clergy had been the most educated medical practitioners in Europe. Now they were forbidden from cutting. The vacuum was filled by barber-surgeons, men whose primary trade was cutting hair and shaving beards. They learned through apprenticeships, watching experienced practitioners, observing procedures, no formal medical education, no anatomical training. Yet they became the primary surgical providers across medieval Europe. They performed amputations, set broken bones, extracted arrows from battlefield wounds using specialized tong-like devices, lanced infections, and bled people on schedule. By 1371 in France, barber-surgeons had paradoxically surpassed master surgeons in status. And that red and white barber pole you still see outside hair salons today? It originated from the blood-stained towels that hung outside their shops, advertising their services. Not everyone in this era was operating in ignorance, though. In 1363, the French physician Guy de Chauliac published his Chirurgia Magna, the Great Surgery, the single most authoritative surgical reference in medieval Europe, and one that remained the standard for 300 years. De Chauliac had survived the Black Death, the bubonic plague pandemic of 1347 to 1351 that killed as many as 50 million people across Europe and Asia, and his writing reflects a medical world in crisis. The plague had exposed humoral theory's catastrophic limits with brutal efficiency. It couldn't explain why the disease spread the way it did, why no amount of purging stopped it, why entire monasteries of well-bled monks died anyway. The Black Death didn't immediately overturn Galenic medicine, but it cracked the foundation, and thinkers like de Chauliac began looking more carefully at what their own eyes were telling them. The transformation of surgery from that brutal world into something resembling modern medicine owes an enormous debt to one man. Ambroise Paré, a French barber surgeon born in 1510. Paré served 4 French kings and is now considered one of the fathers of modern surgery. In 1536, during the siege of Turin, the young Pere ran out of the boiling oil traditionally used to cauterize gunshot wounds. Desperate, he improvised an ointment of egg yolk, rose oil, and turpentine. The next morning, the soldiers treated with his ointment were recovering. Those treated with boiling oil were feverish, in agony, with swollen wounds. It was a revelation. Pere went on to develop the ligature method for amputation, designed early prosthetics, and in 1564 published his treatise on surgery, where he described phantom limb pain and correctly identified that it originated in the brain, not the stump. His motto captured something profoundly humble for an era of such medical arrogance. I dressed him, God cured him. The modern temptation is to dismiss all medieval surgical tools as crude simply because they were pre-modern, but scholars caution against that. Many instruments were carefully designed for specific tasks. The true problems weren't the tools themselves. They were the absence of reliable anesthesia, antisepsis, vascular control, transfusion, and any understanding of post-operative infection. Post-operative mortality rates of 60 to 80% were common, and most deaths came from hospital gangrene. The surgeon's blade might have been sharp, the technique practiced and deliberate, but without any knowledge of what invisible forces were killing patients after the cutting stopped, even the most skilled medieval surgeon was fighting blind. Today you can see these instruments for yourself at institutions like the Medieval Torture Museum in Los Angeles or St. Augustine, Florida, where the line between punishment and early medicine is laid bare. Looking at them behind glass, it's nearly impossible to sort the surgical tools from the instruments of deliberate cruelty. And that's the point. For centuries, there was no meaningful difference. The same table, the same restraints, the same screams. The only distinction was intent, and even that, given the survival rates, felt like a technicality.